Tuesday. This is the picture of Kate that's going absolutely everywhere, and I'm getting tagged in it all over social media and all sorts of emails and everything asking me, is it the same photograph? You're good at this stuff. Is it the same photograph? No, it's not the same photograph. And I'm going to point out some stuff to show off that it is not the same photograph. So in this, what I have done is I've overlayered the photographs in two different layers here. You can see on the right hand side, the background layer is the family photograph. The layer on top is the Vogue magazine picture. Now, this is a genuine reactive smile that's based on trust. What's happening in this photograph is both of her lower eyelids are completely flat when she's activating the tendon called the lateral canthus tendon and the canthus muscle. So as you go up here, you see that the light nearly travels up the outside of her eyes, and that releases endorphins into the bloodstream when you activate that tendon. On her lip as well, the corners of her lips are crested upwards into peaks on both sides. The center of her lip on a different level. And just pay attention as well to her bottom lip. So the bottom lip just arches straight down. We can't see her bottom teeth. Her tongue is on the back of her teeth, but we won't talk about that. That's not the whole point of this. It's just the fact that she has her tongue on the back of her teeth. And her nose is slightly pitched to the right, and she's slightly looking to the right. Now, if I drop the opacity of this image all the way down to this, as we go up and down, you're going to see there's a huge difference in the two images. The first big indication is that it's a different image. Bottom teeth. So on this side and this side, we're seeing her bottom teeth. That is an uncomfortable smile because she's pushing her bottom lip forward, and the arches are completely different on the corners of the mouth. So on the corners of the mouth here, it's peaked, and on this side it goes downwards and it's soft. So again, go up and go down. Two completely different smiles. So this is called a dominant smile. She's smiling on the right side of her face and not on the left side of her face. So she's activating the right eye. She's activating the right side of the mouth. This is a dominant smile. It's a smile that doctors do to patients, people give when you do it on the right side of your face. It's an external indication of, I'm in charge, I'm taking control, I'm able to do this. When we do it on the left side of the face, it's an internal thing, and it's the smile that you usually do on your face when you realize stuff, and you're all doing the exact same thing at the same time, saying, oh yeah, I do that. This, I call it the Joey out of friend smile. It's the how you doing smile, and we do it on the right side of the face. So activating the right eye, activating the right side of the mouth, not activating the left eye, and not activating the left side of the mouth. And her nose is slightly pitched to the left, where in the other one, her nose is slightly pitched to the right. Down here, I know it's poor quality, but you can see there's a mole here on her chin, and the mole is in a completely different position and pitched to a different angle than here in this photograph. So they're completely different. They're actually taken with different lenses, and yeah, it's not the same thing.